You really can't, honestly. Welcome everybody to the executive team Q&A session. I've got my mask on today because I've got a colleague sitting in the room with me, shadowing me today. Today on the Q&A, we've got Julie Attfield, Anne-Marie Newham and John Brewin. So now, without further ado, I'll hand over to you, John, to give us a few words of wisdom before we start the questions.
Thank you, Yolanda. So, afternoon, everybody. Really good to see you all. I'm going to go through a few headlines and then we'll take some questions. We've got some submitted and happy for you to submit them. We'll try and address them in the meeting. We might not be able to all the time, but we will get back at some point. So, headlines. Let's start with all things pandemic. The first is thank yous really to all staff that have availed themselves of the vaccine for COVID. So you'll be aware that we're on. We've done the first 2 vaccines. We're now on boosters. So overall, across the trust, about 95% of staff have had the first 2 vaccines, which is a tremendous achievement. And want to thank everybody for getting themselves done. The offer is always open for those remaining 5% to have their first vaccine at any time. And we're aware of all sorts of reasons why people may be a bit hesitant, but the opportunity, you haven't missed any boat, so that's important. On the boosters, we're doing pretty well. I think we're around about 66-67%. The national target is not specified, but they're hoping for people to get the trust to get up to at least 70%. So we've still got a little way to go on that. But again, that's a really good news story, and thank you. And I know I repeat myself a lot on this, but the social distancing, the use of PPE, lateral flow, prevention, and the vaccinations are the most important things we can do to keep ourselves and our patients and service users safe. So big thanks on that. You'll have heard the controversy around them becoming mandatory from the beginning of April next year. That will become the rule. We don't have any say as a trust about whether we agree with it or not, and we will be asked for all sorts of inputs to make sure that we are compliant with that from the 1st of April. It's still being worked out, some of the detail. Okay, so what does that mean for particular groups? For example, I've had a number of emails from people that are pregnant and fits into that timescale. What do they do? As soon as we know what those detailed rules are, we'll communicate that out to everybody. So if you just bear with, because I know there'll be questions at the minute we won't quite be able to answer. And that means that I think it's the 3rd of February becomes the last day that you can get your first dose to enable enough time for you to have the second by 1st of April. And we'll be putting lots of support for people that perhaps want more information or signposting about and what it means for them, etc. So watch out for that. We'll keep people updated. Related to vaccinations is flu. Flu vaccination season is in full swing. We are a little bit behind in terms of some of the other trusts where their percentage uptake is at. But we know that over the next few weeks we'll be increasing that number. Anne-Marie may want to speak a bit more about that in a minute, but just to say, we've got lots of facilities and availability of the vaccine, and if you've not already, and pass on to your colleagues that that's available. And again, a thing that we would highly recommend that people got. So that's my first bit. not much more to say about pandemic things. The other thing I just wanted to mention, National Staff Survey, it's the final 2 weeks. This is the trophy that is going around on a weekly basis to the most improved response rate team. It's last week had the pleasure to go to the Children's Development Centre at the, I can keep it on the screen because it looks good, doesn't it? It's large and it's very heavy, solid silver with platinum engraving. Went to the Children's Development Centre at City Hospital, who did remarkable improvements. And then tomorrow I'm going to the Impact Adult Secure Services team that got 100% response rate. So it's not too late. It only takes 10 to 15 minutes. It's, as you know, completely confidential, anonymous. There's an opportunity for free text. And there's a question later on. Okay, so what's the point? Because nothing ever happens. We have got a whole list of stuff that happens as a result of the feedback we get on National Staff Survey. So closed on the 26th of November. We're around about 50%, which is good. Still about 5% down on last year, which was a really brilliant year for us last year. So again, if you can tell your friends and your colleagues, you've got 10-15 minutes spare to get that filled in. It's pretty easy to do. Thank you. That's probably as much as I need to say by way of introductions, Yolanda. Before we go into questions, I don't know whether Anne-Maria does want to say anything more about the flu.
Always like to talk about flu, John. Any chance?
Go on then.
So I just want to say we've got over 3,000 staff that have had the flu vaccine. Amazing, amazing, amazing. The clinics have been really full, doing 60 a day on each clinic. So just to say thank you to everybody. Also, you've got to be in it to win it. There's £100 draw per month. And that's pulled off everybody who's had their flu vaccine from anywhere that they've had it, because it goes into something called NIMS, which is the National Immunisation Site. And then we just draw down off that to say you're the winner this month. So we pull it on the 1st of each month, and that will be the winner for the £100 vouchers. So yeah, flu, just want to say a massive, massive, massive thank you. Am I allowed to say anything else, John, about something else that I'd like to announce? Is that all right?
Yolanda's frowning at you, but
is she? Is she frowning?
I'll give you permission.
Will you? Oh, amazing. So I just wanted to say a massive welcome to Lynn Williams, who is the brand new Associate Director of Quality Improvement. If you haven't met her yet, you will know that you've met her. She's full of energy, full of passion around the whole quality improvement agenda. And really, genuinely, this is going to make a massive difference to the organisation. She's already got us networked into all the big, important names like Don Berwick and Helen Bevan and people like that. And I just also wanted to say that we also have got Claire Pearson, who also started, is the Associate Director of Psychological Therapies, and that's another really important post. I wanted to say a massive thank you to Jude Robinson, because she's leaving us. She's been poached by NHSI. Jude is the IPC matron. She's done an amazing job through COVID, flu over the last 2 years. It's been a really difficult time for the IPC team, and I just think that they've done a great job on that. But we have managed to recruit somebody to replace her, who will be joining us. Her name's Kim Shaw. So I know I shouldn't have done those, Yolanda, but I just thought I'd use the chance. Thank you so much.
Thank you, Anne-Maria. And before we go to Yolanda for questions, so Julie's asked a question in the chat about, did I show everybody the solid gold trophy that's got silver inlay and it's got jewels on it and everything? Did the DAS team to win it get to keep it for the year? I think probably what we'll do is the overall the team that does the best, not the last one in the before it closes. So the team with the highest response rate will get to keep it for the year, and we'll even provide a trophy cabinet free of charge, because it's going to need to be heavy. Yolanda, in terms of the questions, because I know we haven't had proper time to prepare for this, because you've been otherwise engaged. I'm happy to, phone's ringing. Happy to take the first question, which I'm not going to answer specifically. There's a couple of comments I want to make to it, and then I'll go back to you to host the rest. Will that be okay?
Absolutely fine, boss.
Thank you. So the first question is, again, a long, quite detailed list of very specific questions around, for example, the manufacture of the vaccine with various links. But there's a piece in it I just wanted to, a part of the narrative of the question, which contrasts me saying that we don't have autonomy in a lot of this, and we're being essentially instructed by the government to act in specific ways in relation to pandemic and vaccination processes, which is true. And then goes on to say, John's noted on multiple occasions that he's disagreed with the decisions the government has taken. I don't think those two things are mutually exclusive. And I'm, happy not to be agreeing with the government all the time. I think it'd be a bit worrying if we agreed with everything the government said all the time. So there may be specific things that personally I don't agree with the decisions that's been made, but that doesn't detract from the sense that that's as may be, but we still got to do as instructed. I just wanted to clarify that, really, that and to re-emphasize that we are still under very heavy instruction over specifics, particularly with regard to the vaccination policy and process. And there's a real push on both the boosters and the childhood immunisations at the moment, and a very sharp focus on our reporting of uptake rates and mitigations that we need to put in place to make sure where we are behind that we catch up and hit certain targets. So that focus has not gone away at all. So that's probably as much as I want to say on the first question, Yolanda. I'm happy to hand back to you.
Thank you very much, John. So the first question, I think I might be coming back to Anne-Maria. So somebody's asked Anne-Maria, how does the Trust get the data to show how many staff have had the COVID-19 vaccination? The person has commented that they've never been asked if they've had it or given their permission for any of their medical records to be available to the workplace. So if you wouldn't mind giving us a response to that, Anne-Maria, that'd be really helpful. Thank you.
Yeah, I think this is a really important part, because I think people will worry about this. So I did mention it just earlier around the flu. So the flu and the COVID vaccine are being logged through the National Immunisation System. So it's called NIMS, N-I-M-S. And we have to, at the beginning of any vaccine campaign, we have to say how many staff we have working for us in the organisation. So firstly, we put in, dependent on what numbers they want to know, we have to put in how many front-facing staff there are, and how many administrative staff there are, and how many bank staff there are. That way, they then know how many staff work for us. Then what happens is when you turn up, it doesn't matter whether or not you've turned up at Kingsmill to go and have your COVID, whether you've turned up at Boots to have your flu, it doesn't matter where you've turned up, that then gets logged to say that you've had your jab, whichever it is. And then they're able to know the number that have had and the number that haven't. So that's how we know our percentages of staff that have had our vaccines. So if I just read you also, there is a very, 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 very limited number of members of staff in this workforce. It tends to work in HR. So that know which staff have had their vaccine groups. Now, when it becomes mandatory from April next year, that very, 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 very few members of staff who know which staff have had vaccines and which staff have not had vaccines, then when it becomes mandatory, we will be given permission to kind of like, not target, but have a chat or send out and say, would you like the vaccine. If there's any hesitancy, let us know why. Is there anything we can do to help you, to support you, to look at it? So the process hasn't yet been determined, and we haven't defined it as yet, and we will receive a full briefing pack when it becomes mandated. But that is how we know the percentage of staff that have had and haven't had any vaccines in this trust.
Thank you, Anne-Maria. A very comprehensive and reassuring answer for colleagues across the organisation. Julie, I know we would normally prepare beforehand and agree who takes which question, which we haven't had the opportunity to do today. So if you're not the most appropriate person to take this question, then feel free to bat it back to somebody else that's on this call. So the next question is about the recent awful incident at Liverpool Women's Hospital. And what the current threat level is in the country, and have we got any guidance on any actions that we should be taking as an organisation? Are you happy to take that question, Julie?
Yeah, thanks, Yolanda. It's interesting how I get things that are terror related, isn't it? That says it speaks volumes, but anyway, yeah, so no, that's it. This is not something to be light-hearted about. Obviously people will have seen the incident that was very shocking actually in the media at the weekend. The current threat level is substantial, but it hasn't been declared. It has not been declared a terrorist incident, I'm advised, although I think it's been portrayed in the media quite variously. Out of caution, counter-terrorism detectives are obviously leading the investigation, so I think that's where that kind of reporting stems from. Although the incident took place at a hospital, there is no indication of any ongoing threat in relation to hospitals or medical facilities. As ever with that level of threat that is substantial, we are advised to urge people to remain calm but be vigilant. And I think we have got policies around you know, what being vigilant means in the organisation in terms of emergency preparedness. And I think, you know, from time to time we do come across incidents, you know, like suspicious packages. So you are encouraged to be vigilant and escalate anything untoward that you may see. So yeah, that's where we are with that. And I think anybody who's got any concerns, escalating it through structure, or indeed Caroline Brooks, who's our emergency preparedness lead, is absolutely spot on. So thank you.
Okay, thank you. The next question is a question that I'm allocating to myself because it's about the Oscars. So I'm agreeing with myself that I'll ask myself that question and answer it. So the question is, has the Oscars closed? Yes, the Oscars have closed. They closed just a few days ago, and we've received a massive 480 nominations. The most we've ever had in the whole history of the Oscars. So thank you to everybody that took time out to nominate colleagues. Really appreciated. So now it's a difficult job with the judges, who I'm sure when they signed up to be judges didn't anticipate they would get anywhere near that number of nominations. So we are sharing that load across the organisation, and thank you to all those who are on the panel. The final shortlist will be shared on Connect in mid-December. So look out for your mates across the organisation who have been shortlisting. The next question, John, now I think this is one of your favourite subjects at the moment. It's that staff survey one, John. I think you hinted at it when you were giving your introduction. They've said they've seen all the promotion asking us to complete the staff survey, but does anything actually change as a result of that feedback? And I know you've got a wealth of information, John, to enable you to respond to that very question. So I'll hand over to you.
Thank you, Yolanda. I don't know if I've mentioned this already, but there are prizes for National Staff Survey completion. Yes, so that's been one of the critiques of it, isn't? And we're familiar with it, aren't we? And you know, there's no point, nothing ever changes. It's a waste of time, blah blah blah. It's something that has been really important, both to me, but also the executive team and the board, that from a trust perspective, we needed to step up into this place. And I think over the last couple of years, we can really start to evidence that what you say to us is taken on board and does really influence how the trust develops and moves forward. So whether we go back to some of the core work we started a couple of years back around culture, values, behaviours, it was a real fundamental building block to where the trust needs to get to in terms of creating the right environments for the right cultures to flourish. And that was informed through some quite significant inputs from the National Staff Survey feedback, a lot of it from the written narrative that people had put in. We collated all that, as well as an engagement programme as well. So that vision of making a difference and the 5 key values that we're working with now is fundamental for us all, and based largely on some National Staff Survey feedback from a couple of years back. One of the other main themes that's been in the feedback in current times has been the health and wellbeing offer to staff, and we've really developed that. And so, for example, we've had over 9,500 referrals and inputs into mental and physical health support services through the wellbeing team, which I think is tremendous facility, which we're still building. And related to that is bringing the occupational health service in-house from January of next year, and we're busy putting that together. Because one of the main commentaries about it was that yes, Nottingham did have one, but it's quite traditional, and it didn't really support and help quite a significant number of our staff issues, particularly working in mental health and community trusts. So it's quite hospital focused. So bringing it here and tailoring it to meet the needs of all our people is critically important. And then finally, a couple of equally important things. One is the continued development of leadership support programs. So we've now got Vision 27, replacing Vision 21, and related leadership circles, and developing the capability. There's lots more to do in that sphere in terms of tailoring more specific and development opportunities right across the patch, that creates and prepares leaders for the future. But I'm really pleased with the progress that we're making. And last but no means least is the work that we've been doing on inclusivity, and particularly around BME and race. So we've got the just and restorative cultures, but we've got a whole number of different things going on across the trust. We're always looking to learn from those and pull in more. Just for example, this morning we had a conversation at the executive team about, okay, so what's the next steps in terms of really driving our inclusivity agenda forward? We still know we're a bit behind the curve in some areas, but all this has been informed by not just the National Staff Survey, but the main headline commentary that we get from it. So just really wanted to emphasise that there's an awful lot that we've done through under the banner of You Said Together We Did, that is really helping the trust move forward. Thanks, Yolanda.
Thank you, John, and thank you, Cara, for putting something in the chat about the fact that you had the pleasure of presenting at Vision 27 this morning. That's really good feedback, thank you. John, just to add to the staff survey, the fact that my office is at the moment full of boxes of biscuits and tea and coffee. So if anybody would like to collect some boxes of biscuits or anything for their teams, to encourage them to take out a few minutes of their busy day to complete the survey. We have stacks of biscuits, coffee, tea. Really, really important question next, John. I think this might be for you. Somebody is asking if we're going to be allowed to carry over 5 days of annual leave again this year into the next annual leave year.
Yeah, so thanks, Yolanda. This is a really important question, but I'm going to defer it for next time, because there's quite a bit. So it's in play obviously for this year, but for next year there's just a few sort of infrastructural stuff and process things we just need to work through before we come back and announce. So if we could hold that one and put it on the list for next time, and we'll make sure that we get a communication out on that. Thanks. You've gone on mute.
Of course I have, John. Some say I should stay on mute permanently. The next question is about an extra reward for people that are working Christmas Day, Boxing Day and New Year's Eve. So I don't know whether you want to just follow on with what we've just been talking about, John, and whether you want to take that one as well. So the question is, accepting that we're still in these strange COVID times, are we going to be able to give those staff, do we want to give those staff working on Christmas Day, Boxing Day and New Year's Eve, overnight, an extra reward? Not thinking much, maybe just takeaway vouchers to enable them to get in hot food, and then they've put all COVID compliant, of course.
Of course, everything has to be COVID compliant. So without getting into specifics, the general answer to this question is yes. We really need to make sure that we recognise what we do for our staff. But there's a whole load of things that we are currently looking at across the trust over particular working hours and working days as the festive season approaches. I'm not going to specifically say yes to those things there. I know there's options, we know, whether it's food or vouchers, but access to a hot meal is really important, isn't it? And but I suppose the takeaway for this is, no pun intended, is watch this space, and we will be making some clear announcements through our good communications channels, Yolanda, about what sort of additional stuff we can put in for that festive period. Thank you.
Thank you, John. That ends all the questions that we've got. So are you happy now to sum up, John? Is that okay?
Yeah, I am. The reason I'm a little bit hesitant, I got a random question in an email this morning. I thought, well, that'd be a really good one to ask at the Q&A, but guess what? Can't find it, and I can't remember what it was.
Can I just do a fill, Yolanda?
Another one?
Yeah, I know.
You might have a fill before.
I know. Well, I either don't say anything or I say everything.
Go
just
on.
Whilst he finds it, I wanted to mention charitable funds. A lot of the staff across the organisation have said they didn't realise that we have a charitable funds pot of money, and actually we're sitting on quite a bit, in the region of about 1.3 million. And what I've been explaining to people when I've been going around is that charitable funds are quite an interesting thing. You get a spreadsheet with lots and lots of lines, and people donate or give or ask for money to be given in. Sometimes they'll specify what they want the money spent on, and sometimes they won't specify anything, and therefore it can be generally used. More often than not, they'll say things like, I want it spent on, I don't know, student nurses, I want it spent on equipment to make the nurses' lives easier, or whoever's work. It could be absolutely anything. But what I've been saying to people is that we need to make better use of it. And if there are things that certainly when I've been walking around, staff have often said to me, oh, we could really do with, I don't know, some more equipment, or we could really do with some of the music coordinators have done some fantastic work with activities around music for our patients. So if you have got something that needs replacing or something new that you need, particularly to make the lives of staff and patients better, then actually just drop a note to Alison Wild in finance, and she'll get back to you about how you can apply.
Thanks, Anne-Maria. Just to say that nearly all departments and teams have their own charitable funds. So if you do want to spend that money, it probably in the first instance speak to your line manager about utilising that money.
Yeah.
John, have you managed to find the email? And Julie, have you got anything you wish to add?
So I have found my email. I'm not as inept as you thought, because you're all sitting there thinking, no, he's not going to be able to find it, is he? But I have actually. And it is a very good question. So, but it relates to the vaccination mandatoriness thing, not a word. So, and it's one of those detailed questions which, as yet, is a good example of we don't know what the rules are going to be. So it's essentially from someone that's working in our offender health in prisons, asking what the rules will be for those staff that are working with other staff co-located who aren't part of the NHS, so i.e. prison staff who won't be mandated or aren't mandated yet to take the vaccine, and whether therefore there will be some exclusions, because from a logic model that it makes, so you could argue it doesn't really make sense. That either all should be vaccinated or you don't make it mandatory. But it's a great question, and we at the minute it's a good example, like I say, of where we'll start to get some clarification on those different environments where we've got staff across the whole of the trust. So again, it's a watch this space, and I'm sure there'll be a number of those, won't there, that will come in over the next few weeks of, we're working here, what does it mean for us? And we will be able to provide clarity on that as the weeks pass. Thank you.
Thanks, John. Julie, I saw that you had taken yourself off mute. So before we hand back to John to sum up, is there anything that you wanted to say while you're on the call today, please?
Yeah, so I just wanted to say thank you for staff who are currently being redeployed around some of the areas where we've got some staffing pressures, and also to thank people who responded to John's email a couple of weeks ago about willing volunteers for being redeployed. So a lot of that's in train, so to say a big thank you. Also, we are, as you would expect, working on staffing and preparation, obviously, for the next two rotas, where we'll obviously be part of a system-wide response in terms of winter pressures. So just to say that we're going to be communicating next week about some of our bank seasonal pay rates and incentives. So just encouraging staff to think about booking in proactively in terms of bank shifts and making the most of the incentives that will be in place over the next two rotas. So just to say a big thank you, and watch out for that. Thanks.
Okay, so back to you then, John. We've not had any more questions come in either on email or in the chat. So if I could just hand back to you to sum up today's call. Thank you.
Thanks very much. Thanks everybody for your inputs and for tuning in today. And to echo Julie's last comment, really, to finish with a huge thank you to everybody across the trust. Again, appreciating it remains really tricky, doesn't it, in terms of the pressures that everybody's under, managing those darned viruses and the COVID rates, which don't seem to be looking to be reducing anytime soon. And to echo, please to make sure that you stay safe, that we do social distancing and use PPE, do your lateral flow tests, get them recorded, and watch out for updates on vaccine news. I think that'll be quite a fast-paced agenda of updates and clarifications, and there'll be quite a bit on that in the coming weeks. And thank you to everybody for all that you're doing. It's much appreciated. And if you do get 10 minutes, there's always that trophy to keep for the year. Thanks, Yolanda.